This season of This Headache Journey is sponsored by gammaCore non-invasive vagus nerve stimulator, the drug-free solution for migraine and cluster headache. gammaCore is the first and only FDA-cleared non-invasive device to treat and prevent multiple types of headache pain via the vagus nerve. It's small, handheld, and portable for quick and easy treatments whenever and wherever needed. gammaCore is safe, effective, and easy to use. Learn more at gammacore.com. That's GAMMA core.com. Hi, I'm Adam Flaherty. Welcome to episode 6 of This Headache Journey, a podcast for people who experience chronic headaches and migraine. Over the past 15 years or so, I've tried many different interventions, as I'm sure you have as well. And in this podcast, I'm recounting many of the things I've tried so that you can be more informed and empowered in your headache journey. This podcast is something I would have loved to have when I first started examining the causes and management of my own pain. I want to remind you that I am not a doctor, and nothing contained in this episode constitutes medical advice in any way. Each episode of This Headache Journey is centered on a different intervention or modality, and today's episode is about EMDR therapy. I'm looking forward to telling you about my experience trying EMDR and introducing you to Elizabeth Bardwell, who will explain how this type of therapy has helped many people to reduce chronic pain. And before we get into it, I'm going to do that very podcasty thing of asking you to please subscribe to This Headache Journey wherever you're listening, and that might be Apple Podcasts, Spotify, Amazon Music, Overcast, Pocket Casts, Hark Audio, or anywhere else. Please consider leaving a short review. Maybe most importantly, please text this episode to someone you care about who experiences chronic headaches or migraine. It would mean the world to me, but it might be the thing that helps them find some pain relief too. EMDR stands for Eye Movement Desensitization and Reprocessing Therapy. I don't remember specifically when I first heard about EMDR, but I do recall always feeling curious about how something as simple as eye movements could impact the headaches that I've been having for decades. I did some Googling at one point, maybe 10 years ago, and learned that it's not the physical movement of the eyes that has a direct correlation to the physical pain, but rather that this is more of a mental health exercise, hence the word therapy. And up until that point, I hadn't really considered that my headaches could be a result of stress or anxiety or mental health. But the more I paid attention to that, it became pretty clear that my headaches were more consistent and more intense during periods of high anxiety. Now, I've never participated in traditional therapy. I recognize how useful and helpful it can be, but I've always felt that I had a pretty safe childhood and haven't been able to point to much in my past that I'd consider trauma. But when I started meeting with Elizabeth and she began asking me about my family, my work, and my life experiences, it turned out there was plenty to explore there. In that exploration, we zeroed in on a couple of things that are currently causing me anxiety and thus increasing the frequency and severity of my headaches. I'll be curious to hear your thoughts after hearing this conversation with Elizabeth Bardwell about EMDR therapy.
My name is Elizabeth Bardwell, and I'm a licensed clinical professional counselor. My practice is called Tide Meadow Counseling, and I'm in York, Maine. I work with individuals, couples, and families on mental health issues and utilize EMDR and EFT.
So I had reached out to you a number of months back specifically for EMDR therapy, and it's something that I'd been interested in exploring for a little while, but hadn't done a lot of research into who was out there and who was involved in that practice in this area. Can you give kind of a high-level explanation of what EMDR is and what applications it can be most effective for?
So EMDR stands for Eye Movement Desensitization and Reprocessing, and it was developed by Francine Shapiro 25, 30 years ago. She noticed that eye movement, which stimulates both sides of the brain, showed to have a reduction in depression, anxiety, trauma responses, and eventually pain.
I came to you specifically with chronic headaches that I've had for years, but what other types of pain can be reduced or helped by EMDR?
Any kind of physical pain. It has been shown to help with, back pain, medical pain, medical trauma. There's good evidence on headaches, but mostly it's used for emotional pain related to, it's approved by the VA for veterans and trauma responses related to war.
That's interesting. And I remember in our first session together, I was talking to you about my headaches, and you said, well, EMDR can help for physical pain, but typically we're addressing something else, something bigger, that the physical pain is a byproduct of.
Well, I think as this profession has developed over time, it went from solely looking at emotional responses to trying to understand how the body holds emotions and where it comes out. So there are somatic therapies that connect the body and mind, and EMDR is trying to shift how the emotions are held in the body. So like I would ask, where do you feel that particular emotion in your body? Oh, I feel it in my stomach, or I feel it in my throat. It's acknowledging that our body and our brain work together. So if we have an emotional disturbance, it can show up in the body. So it's paying attention to both, rather than in traditional talk therapy, you just talk about your emotions and try to intellectualize how not to feel that way anymore.
So for somebody who fell off a motorcycle and broke their leg, it sounds like EMDR may not be the first thing that they should go to help with their pain. Is that?
Well, unless they won't get on a motorcycle anymore, or unless they're having flashbacks, or if there's something related to the accident or how they feel about their leg or the pain in their leg. I don't think a lot of people would say, oh, you're in a car accident or a motorcycle accident and you only broke your leg, go do EMDR. If there was an emotional component attached to the broken leg, then yeah, I think that would be great. Not to say that you shouldn't do it, but that's not how it's being used right now.
And so I'm thinking about, in my particular case, we had maybe 4 sessions before we even got into the actual EMDR. And a lot of that, I have never gone to a traditional therapy or counseling session, but that's what I imagine that would be more akin to. And you were asking me a lot of questions about my family and my work and what I do outside of work and the things that cause me stress. And why were you asking those types of questions in those early sessions?
I wanted to understand how your headaches might be connected to your emotions, right? So what are the stressors in your life? What negative beliefs are you holding about yourself, potentially, that are leading to whatever physical mechanism causes headaches? In some ways, I feel like I should know more biology in order to understand how the emotion and the biology work together. But interestingly, I've found that EMDR doesn't. It works whether or not you understand it. And that's a bit suspect for those of us who appreciate science and we want hard, cold facts. But it's kind of the way that it works with EMDR.
It's not the first time that I've heard that. And I think there's really something to that. And part of it, from what I understand, is that it is just a matter of funding for research on it. The inability to get funding to do proper research to show why it works. And until you have that, you kind of just need to have a willingness to experiment with something and know that it has worked for people and does work for people.
I think there is research. It's just not as well researched as some other modalities like cognitive behavioral therapy, or insurance companies like to pay for things that show it can work. And EMDR is not just anecdotal. There is research, but it also seems to have this kind of magical component to it that can't be wholly explained. And so I'm sure insurance companies don't want to do that.
Well, I'm sure anybody like myself who's been suffering from chronic headaches for months or years or decades is fully open to magic if it's the thing that works.
Yeah, I thought it was kind of maybe a little hokey pokey, and then I went and tried it myself on an issue that I was having. It wasn't a pain issue, but it was something that was really long-standing and had kind of stuck with me and impacted the way I felt about myself and the world for 30 years. And without going through a lot of talk and history and, because I was sent by one therapist to another therapist, and one therapist had done that pre-work, and the second therapist just did the EMDR. So she barely knew what the issue was. And she walked me through it, and it resolved the issue. And I thought that's something I want to learn how to do.
Mm-hmm. Mm-hmm. For somebody who learned that the EM part of EMDR is eye movement, there may be an assumption that this has something to do with vision or visual therapy, but it doesn't. It has nothing to do with the health of your eye or your vision. So what is the eye movement?
It's stimulating both sides of the brain. So you can do it with tapping. You can tap on your shoulders or tap on your knees. There are little sensors that you can put in your hands, and they go off alternatively. You can use your hearing. It doesn't have to be eye. That represents the bilateral stimulation of the brain.
Okay, and that's really interesting. I'd love to dig into a little bit more of that. So what does the bilateral stimulation, how does that lead to opening these sort of pathways to discover how you feel about yourself or what's causing you stress or trauma?
From what I understand, it gives the brain a chance to, I don't know exactly what mechanism is at work, but it gives the brain a chance to rethink about, go back in time, think about and reprocess that experience, that image, that memory, that emotion, and come out with something different. Honestly, I don't know how it does that.
That's the magic part.
Yeah, I mean, it's fascinating. I lent you my book on EMDR, and I don't know if you found anything in there that answered that question. I haven't been able to figure that one out yet.
I mean, I think what I learned, and again, I am not a doctor, but this will be a totally bastardized way of explaining the same thing that you're saying, is that by sort of tricking your brain by ping-ponging back and forth between the right and the left hemispheres, that it creates some kind of loophole where you can access things that when you're just sitting and having a discussion about, you may not be able to, what's the word?
Access?
Yeah, to access or recover otherwise.
Yeah. I mean, from my own experience and doing this with other people, it seems like, one of the factors is you have to have a dual awareness, meaning you're in this room working with your therapist, but you're also able to put yourself in the past or in the future or in a state of pain, right, in your case. So within that state, so that's sort of a bit of a dissociative state, right? So you're already altering what's happening in your mind, but not with drugs, just yourself. I mean, we do it when we're driving and we get to some place and I'm like, I don't remember getting here, but that you were driving safely. So you're in this dissociative state, and then you're able to use your adult, your logical, your cognitive, your rational brain, because you're not emotionally dysregulated. When something happens, when you're in the pain state or you're in a motorcycle accident, you're in fight or flight. And then your brain makes sense of what's happening, and you come out of it with a belief about yourself and the world. So when you re-experience that and you're not in fight or flight, you're better able to analyze it and deal with it.
So is it more effective for somebody who experiences headaches? Would it potentially be more effective for them to do EMDR sessions when they're experiencing the pain or when they are not experiencing it?
That's a good question. Didn't we try both?
So we had 3 or 4 sessions just talking, then maybe 3 sessions of EMDR, and I know that at least for one of them, I had a pretty intense headache. I don't remember about the rest.
I think we did 2 without and 1 or 2 with, and I think I remember that the level of pain reduced. It wasn't eliminated.
I do remember that.
Yeah. I think it could be helpful to do it both ways.
Yeah.
Because you're in 2 different states.
So how is this different? You sort of just said it in that you need to be both aware and able to place yourself in a different environment. Mm-hmm. How is EMDR different from like a hypnosis where you're getting yourself into this deep state of suggestibility and working to change something in your life, a habit or a pain sensation or whatever it might be?
I don't see it as very similar to hypnosis at all, because the therapist doesn't suggest, you're not losing control of yourself. You're in charge. You're doing the work. The brain is doing the work, and the therapist can interweave an idea, but the person is so awake and aware that they're not being told to like act like a chicken or something like that, or even just don't feel the pain, right? It's not. Hypnosis to me is about somebody else controlling externally, and EMDR is internal control. That's how I see it.
So can you give listeners an idea of how the session might actually run? Mm-hmm. And I'm happy to contribute too, because I've been on the other end of it.
Yeah. So first, we work on coming up with a presenting issue or memory. So in your case, it would have been, migraines, painful headaches. We come up with an image, what picture represents the worst part of that, or what sensation. And then I think this is for me, the most important step, the negative cognition. What words go best with that picture or incident that express your negative belief about yourself now? It's not how you felt about yourself in the past. It's how you feel about yourself now. So you're trying to tie in thoughts, feelings today with the past. Some of those could be, I don't have any power, I'm powerless, I'm helpless. Like with the pain, it's never going to go. I can never do anything to affect change. Mm-hmm.
Which I imagine is something that a lot of people listening have experienced, that a feeling of helplessness when you've tried so many things and haven't found a solution.
Right. And then you want to come up with a positive cognition. So the opposite. I am powerful, or I can affect change, or you want the opposite. Then you get the validity of the cognition. So between 1 and 7, 1 not being true at all, 7 being absolutely true. How true does that seem right now? And then you come up with emotions. When you bring up that picture and incident and those words of the negative cognition, what emotions do you feel now? So again, you're bringing it into the present. And then we assess the subjective unit of disturbance. So from 0, no disturbance or neutral on it, to 10, the highest disturbance you can feel. Where are you right now? So we're looking for 7, 8, 9, somewhere in there. You want to start with something that has some energy behind it. If you start at a 2, you might actually be able to resolve that with talk therapy, right? You want something high emotion. And then where do you feel that emotion in your body? If we're dealing with pain, it's going to be very obvious. And then I would ask the client to sort of know that they're in the room, but put their attention on all of that, the negative cognition, the sensation in the body, the emotions, the image. And then we would have previously chosen a method of bilateral stimulation. So I would ask them to do that or help them do that. And 30, 40 seconds, that's sort of where the therapist has to make a judgment on how long to go, how fast to go with the stimulation. you're watching body language. You're making sure that people aren't getting overwhelmed or distracted. Like in my office, you can hear cars, so you're checking in. Then you stop them. You say, take a deep breath in, let it out. What did you notice? And they could say, do you want me to go through the options of people, like what people,
Sure.
how people respond?
Sure.
Some people could say, nothing. I didn't notice anything. Or I noticed that the cars were going by and I'm thinking about how I need to go to the grocery store. Or they could say, well, I felt a tension here, or I remembered this. So the therapist then has to navigate the responses. But you don't want to talk about the responses. You want to acknowledge them, but it's not a conversation. You go with what the client gives you, and you ask them, put your attention on that, and then go again, another set of stimulation. And you do that over and over and over, and things typically move. People don't stay stagnant in that same place, but you have to follow where they go and try to make sense of it, not verbally in a conversation with them at the time, but you're taking notes as a therapist and saying, okay, here's a theme that's coming up, or just follow the pattern. And really, it's kind of easier for the therapist because the client's doing all the work. Mm-hmm. You're just observing. And then once the SUD, subjective unit of disturbance, is down to 0, 1, or 2, then you go back to the original image and say, what do you notice now? Mm-hmm. Are you still, what's left of this? And then you go again, and you're really trying to get down to 0. But there are a lot of steps in between. This is the sort of quick and dirty, no issues coming up version of this procedure.
And in my case, I don't think that I had any issues come up. I mean, it felt very calm the whole time. It was actually very relaxing mm-hmm. for me. And just to paint a little more clear of a picture for listeners, Elizabeth, you mentioned the different types of mm-hmm. bilateral stimulation. So for me, we decided that because I have a condition where I have good vision, but my eyes struggle to refocus quickly at things at different depths, and extremely, moving my eyes to one side or the other can actually increase my headache. We decided that for me, I would do tapping on my legs. And so in those 30 to 40 second increments where you ask a question and then I'm sort of thinking about it, I'm tapping my legs at a interval, maybe a little bit slower than this. Maybe, what's it like?
When we're trying to reprocess, we go faster. When we're trying to install the positive cognition, once people tend to get to the positive cognition on their own, and then you want to install that and make sure that that's solid. And so then you do slow sets, fewer, like for a shorter period of time. You go 10, 20 seconds more slowly.
Okay. Mm-hmm. And again, this is just speaking to my case. We weren't specifically talking about my headaches or focusing on my headaches. What we were focusing on were things in my life, and there were a couple different things that we focused on that bring me a lot of anxiety. Mm-hmm. And it was thinking about those things and working through those areas where I felt stuck.
Mm-hmm. Which might be contributing to causing headaches.
Correct.
Right.
Correct. And so what I found was that, there's these things that I know that cause me a lot of stress and anxiety. And I do know that when I'm feeling particularly stressed, especially over a period of days, that my headaches tend to correlate with that. But I hadn't sat down and really considered how to work through those things. And so this, for me, was extremely helpful in thinking about those things objectively and considering how I can either work through them or make modifications in my life to kind of accommodate for those things mm-hmm. in a way that can help to keep mm-hmm. me more calm and reduce my stress. Mm-hmm. And so that was what I found to be the most helpful for this.
What was interesting to me in your case was that it didn't seem like you were, it gave you the opportunity to connect some things that weren't in your conscious awareness.
Right.
Right. You're like, oh, like it just seemed like there was a few light bulb moments that it was interesting to observe that.
Yeah. And like I shared earlier, we did 3 to 4 EMDR sessions and then put it on hold because I feel like we did work through some really important things, but kind of left the door open for if these anxiety-inducing things come up again or other things, we can revisit it and continue with the work, which I really appreciate and expect that I will at some point. What kinds of results have you seen from patients who've suffered from chronic pain? Do you have any, obviously being mindful of confidentiality, any real success stories that you've always held on to?
Physical pain? It feels like it was more secondary. I don't think people realized they were holding physical pain. Like they came in because, say, they were in an accident or somebody died or they had medical trauma or something. And they didn't realize until after EMDR that they were holding it in their body, right? So you were the first one who came in and said, I have a physical complaint and I want to try this. For others, it was, low back pain, like IBS, other physical complaints that were resolved after the emotional things were addressed.
And so I really was working in reverse.
Right.
Was that a unique challenge for you?
Yeah, that was. I definitely made some calls. I put out some feelers on, okay, any specific protocol on this, and anybody have any other experience? Other EMDR therapists, and
did you get any interesting feedback from them?
Yeah, I mean, the feedback was this is really helpful, but it's not the typical way that it's. But it could be. It should be. Why shouldn't it be? Maybe that's a flaw in the marketing of therapy. We're sort of known for emotional pain, not physical pain. But I bet that changes over time because we're understanding the connection between body and mind a lot more now.
Well, thank you, Elizabeth, for taking the time to educate us. And listeners, you can learn more about Elizabeth and her practice by clicking the Tide Meadow Counseling link in our episode notes. And this was fantastic.
You're very welcome. Thanks for taking the time.
Like I told Elizabeth, I'll likely return for more EMDR sessions. Although I can't say for sure if EMDR reduced my headaches, going through this exercise with her several times did help me to put some stressful situations into perspective and think more objectively about how to work through them in a healthier way. In other words, I do absolutely buy into the bilateral stimulation part of the therapy, but even the counseling component of our sessions was really enjoyable and relaxing, and probably something I should have been doing for years as a way to manage stress. So what do you think about EMDR? Does my experience combined with Elizabeth's explanation of how it works for so many people make you want to bring it up with your PCP or neurologist? Please let me know by leaving a review of this headache journey on Apple Podcasts or wherever you listen. And again, this would be a great opportunity to text or email this episode to someone you care about who suffers from chronic headaches or migraine, so they can consider whether EMDR is something they might want to explore. Thanks to Elizabeth for enlightening us about EMDR therapy. Thanks to GammaCore, the non-invasive vagus nerve stimulator, for sponsoring this season of the podcast. And thank you for joining me on this headache journey.